So you've woken up with pain in the front of your knee. There might be a reason for it. The day previous, you might have done a lot of hiking and a lot of downhill walking. You might have resumed your local sports team where you've done a lot of sprint stop work that you're not used to. It's unaccustomed activity. It might have just come on out of the blue. So you've got this knee pain, you've got this new click that's happening and you're concerned about the click. You go downstairs and it's agony. You actually have to go downstairs sideways because it hurts to go forward. You've spoken to your friends who have had knee pain at the front of the knee, and they have said that you might need to see a doctor, you might have arthritis, or you might even need to see a surgeon. Now, in the majority of cases, none of this actually eventuates, and most of the time we can get through anterior knee pain with the right management plan and the right rehab. So what is anterior knee pain? What actually happens? So we've got our knee, we've got our kneecap that sits nicely in the groove, and when we bend and straighten, that knee glides smoothly in the groove. If we do a lot of bending, loaded bending, as we spoke about previously, then we can irritate that joint and the joint can become a bit inflamed and a bit sensitive. Now, it usually becomes sensitive to movements where your knee goes forward. So that's when we're going downstairs, we're descending, we get pain in that position. Now, that is a position that in the short term we need to limit and we need to control. So we've got some exercises that we can start to take you back from that position and strengthen you away from that. But then long term we need to revert back to that position when all of these structures settle down, and that will happen. Other things that we need to look at with your front of knee pain is your hip strength. So is that related to your kneecap? We know from research that that is the case, so that might be a factor. Also, we need to look at your foot mechanics. Do you pronate excessively? Is this a factor related to your knee pain? We can figure this out in the appointment when you book in to get your knee pain assessed. Let's now go and have a look at some exercises that might be the starting point